Meet you, Joseph. Thank you for coming in to see me in regards to starting a new exercise program. Just first of all, what would you say is your major issue at the moment?
Well, I've got diabetes, I'm overweight, and I've got no energy to do anything.
Yeah, no worries. So what would you say you'd most like to achieve from this program?
I'd like to lose the weight and just
Yeah,
feel better and just be able to live long enough to see my kids grow up.
yeah.
Grow up.
How many kids do you have?
2 kids.
Yeah, very nice. So obviously we're going to try our best to achieve these goals. But before we get into it, I will need to run through a simple pre-screening questionnaire.
Right.
This is just a number of questions regarding your physical, social and medical history.
Yeah.
And it just allows me to identify any potential risk factors you may display before beginning your program.
Mm-hmm.
So just to start, just your name and date of birth, please.
I'm Joseph, and I was born on 18th of October 1970.
No worries. Obviously male.
Yeah.
So has your doctor ever told you that you have a heart condition, or have you ever suffered a stroke?
No.
No? Do you ever experience unexplained pains in your chest at rest or during physical exercise?
No.
No? Do you ever feel faint or have spells of dizziness during physical activity that causes you to lose balance?
No.
No? Good. Have you had an asthma attack requiring immediate medical attention at any stage of the last 12 months?
No.
No? Good. If you have diabetes, type 1 or type 2, have you had trouble controlling your blood glucose in the last 3 months?
Yeah.
And just out of interest, which diabetes is it? Type 1 or type 2?
Type 2.
Yeah, cool. Do you have any diagnosed muscle, bone or joint problems that you've been told may be made worse by physical activity?
No.
Good. And do you have any other medical conditions that may make it dangerous for you to participate in exercise?
Oh, I've got high blood pressure. I'm
Yep.
medication for that.
Yeah, righto. No worries. So if you could just sign the bottom there for me, mate, that'd be perfect.
Yeah.
Thank you. So now just a few more simple questions here. So just your age and gender.
I'm 47 and I'm a male.
Yeah. In terms of family history, have you ever had someone in your family with a heart disease?
Yeah, my dad.
Yeah, Dad. And how old was he at this stage?
A bit younger than me. He was about 40, I think.
Yeah, righto. Do you smoke cigarettes on a daily basis or weekly basis, or have you quit smoking in the last 6 months?
I quit 2 years ago.
Oh, very good.
Yeah.
And you haven't smoked since?
No.
Great news. Very well done. Could you describe your current physical activity levels for me?
Very rare.
Very rare?
Yeah,
So in
maybe
terms
half
of
an hour a week.
half hour a week?
Yeah,
Righto.
if I'm lucky.
Yeah, no worries. Could you, like your height and weight, please?
Well, I weigh 178 centimetres tall and I weigh 110 kilos, Tom.
No worries. Have you ever been told that you have high blood pressure?
Yeah, I'm on medication.
Yeah. Have you been told you have high cholesterol?
Oh, I think the doctor suspects I have.
Yeah.
And sent me off. I had some blood tests just
Right.
recently, so I think I'm not really sure of the results of that.
No worries. Have you been told that you have high blood sugar?
Yeah, I'm on insulin. Yeah.
Right. Have you spent time in hospital, and this includes day admission, for any medical condition or injury or illness in the last 12 months?
No.
Very good. So you mentioned you're on a number of medications. So do you know what they are?
Well, I take, what is it, an ACE?
ACE inhibitor
yeah,
for blood pressure?
For blood pressure. I couldn't tell you the name of it. But,
Yeah.
And I'm on insulin now. I used to be on
Metformin?
Yeah,
Yeah, no worries.
but I'm on insulin now.
Yeah, right.
Yeah.
I have to ask this, but are you pregnant or have you given birth within the last 12 months?
No.
Obviously not.
No.
Do you have any muscle, bone or joint pain or any soreness that is made particularly worse by activity?
No.
No?
Don't do it now.
No worries. So obviously your doctor has sent me through the results from these blood tests and that.
Oh, yeah.
But first I will say BMI is 34.7, which unfortunately does put you in the obese category.
No, yeah.
But,
No surprise.
well, here you are looking to start an exercise program, so with a bit of luck, that'll be on its way down into the healthy zone in no time.
Yeah.
Same with your waist girth, 118 centimetres. So realistically, a healthy male's sort of around 94 centimetres.
94.
Yeah. So we're
Right.
quite a bit larger than that. But as I said, once we start the program, hopefully we'll
Step
start.
one.
Yeah, exactly right. Resting blood pressure is, it's obviously, you have high blood pressure, but it's
Yeah.
155 over 95,
Yeah.
which is significantly higher than a healthy range of 120 over 80.
Well, I'm on the pills.
Yeah.
Not looking
Yeah.
good, Tommy.
We'll be right, we'll get you back.
Thanks.
And your total cholesterol levels, and that's far too high as well.
Yeah.
HDL, which is the good cholesterol, it's unfortunately too low. And your triglycerides and the bad cholesterols are also too high. So that's that.
You got a bit of work to do then.
We do, absolutely. All these goals. So thanks for that. Just a few more questions regarding yourself.
Yeah.
But they're not covered in the pre-screen.
Okay.
So how would you describe your social support group? So are you in a relationship?
Yeah, married.
Married with the 2 kids?
Yeah.
Very good.
Yeah.
So how would you describe your cultural background as well? Are you like Caucasian or
I'm Aboriginal.
Indigenous? Yeah, very good.
Came from Townsville.
Yeah, nice. Could you describe your diet to me? So what would a typical day's meal plan sort of look like?
Well, I work in the fast food industry, so I'm nibbling all day on whatever I'm cooking for other people.
Yeah.
Not very healthy. I've tried.
Yeah,
but I do like the fried foods and
and
it's
when it's
tempting
there,
when it's around.
for sure.
Yeah.
So you mentioned too that you're relatively inactive when it comes to physical activity and exercise.
Yeah, the doctor
So
tried to get me to go to the gym, but
I
just don't have the time, mate.
no time yet.
Yeah, work long hours in the shop and
Yeah, for sure. It's difficult. So besides time, is there any reason that you'd say that, like that you wouldn't work, like with family, or do you just not enjoy exercise in particular?
Don't really like it.
Yeah.
But the hours at the shop keep me a bit busy, and maybe I use it as an excuse. But yeah, I don't really like the gym.
Yeah, no, fair enough. I can definitely understand that. I can imagine working full-time role as you do would be very difficult to find the time.
There's too many, young, good bodies down there, and it's a bit embarrassing, to be honest.
Absolutely, yeah, I can definitely understand that myself. So you said that you have type 2 diabetes, but just out of interest, was the condition ever explained to you when you were diagnosed, or were you just told that you had diabetes and these are the medications to take?
Yeah, a bit of that, really.
Yeah.
I've heard of it before, but I don't really know.
Yeah, unfortunately that is usually the case, but put simply, type 2 diabetes, it's a condition where the body fails to metabolise sugars correctly. So this is known as hyperglycemia. You may have heard about that.
Yeah.
And this can increase the likelihood of developing other conditions, such as hypertension, so your high blood pressure, dyslipidemia, which is your high cholesterols and all that, and obesity, which obviously sort of comes with the...
Ticking all the boxes.
Yeah, so these were all observed in your measurements, as you said, and as this progresses, it does begin to put extra stress on other organs. Yeah. So your kidneys, your liver and your heart, all sort of more pressures put on them. And
I've been getting a bit of swelling around my ankles and hands, and that'd be related to that, I guess.
Absolutely, would. Yeah, for sure.
Right.
So obviously reducing the effects of this condition, it's vital, and you've taken the right step.
Yeah.
So hopefully we can sort it out. But so type 2 diabetes, it has a number of risk factors that increase your chances of developing the condition. And obviously diet is a major one of these. And so as you said, you're eating a lot of processed foods and red meats and just pretty simple carbs, I imagine, with chips and that.
Yeah.
And so they're known to increase the likelihood of developing type 2 diabetes. And would you say, do you drink much tea, or are you more a sugary drinks like Coke and lemonade? And
yeah, pretty easy to just grab a drink out of the fridge.
Straight out of the fridge, Yeah, so unfortunately these are the same. They increase your risk of developing the condition. So what we try and do is try and suggest maybe tea instead. Tea or coffee, or water, ideally.
Oh, yeah.
But, yeah.
Great. Looking forward to
Yeah,
this time.
no. But another common risk factor is physical inactivity. And so, as you said, you live a pretty sedentary lifestyle, so you're not really out and about at the moment.
No.
And unfortunately, that increases the condition as well.
Yeah.
But unfortunately, another major one is ethnicity. So, as you said, you identify as an Indigenous Australian, and that actually means, in terms of like the condition, you're actually four times more likely to develop type 2 diabetes.
Blame the family then, eh?
Okay, yeah, it is a bit of family history, unfortunately.
Not my fault.
Nah. But yeah, so as you can see, there are a number of reasons why you may have developed this condition.
Yeah, okay.
But in terms of dealing with the condition, how would you say you're managing it at the moment? Like, how do you go with your insulin?
Oh, I hate those injections.
Yeah, not a fan of needles? Or?
No, and it's just I just forget to take it to work sometimes. You know, you've got to remember.
Yeah.
Yeah, I'm pretty hopeless.
Yeah, for sure, yeah.
And jabbing yourself with a needle every day is no fun.
No, I can imagine. I'm not a big fan of needles myself, so that doesn't appeal to me at all.
Yeah, so, I'm pretty, not real good.
Yeah, no worries. Would you say it affects your day-to-day life or your ability to exercise?
Being diabetic?
Just, you can, like, having diabetes.
Yeah, I've got no energy.
No energy, yeah.
Finished work, I just want to come home and flop and...
Lay down, watch TV.
Yeah, that's right.
I understand that.
Yeah.
So obviously, with this program, we will look to increase your energy and make you feel better, just in general.
Well, I hope you can.
Yeah. But in terms of, like, straight after exercising, you do see a number of, like, responses to training, and these will make you feel better, hopefully.
Yeah.
But these sort of things, they include, like, a reduction of your blood sugar level, your blood pressure, and cholesterol.
Yeah.
So that's directly, like, immediately after training.
Yep.
And so, like, these can last for up to 72 hours.
Oh, really?
Yeah, and as does an increased metabolism, so that'll help burn off the extra fat and all that. And as I said, that lasts for 72 hours, so it's not permission to go and eat everything, but yeah, it does help burn it down. In terms of term effects of exercise, we should see a decrease in a number of, like, things that you're having trouble with at the moment. So obviously, cholesterol levels, blood pressure, your hemoglobin A1C, and your albumin creatinine ratio. So these will all reduce with increased physical activity. Importantly, long-term exercise has been shown to regulate and control your blood sugar level. So that's a major thing for you.
Right.
And that'll make you feel much better.
Right.
And it also helps strip off visceral fat.
Yeah,
so obviously, the more we exercise, the more likely you are to achieve your goal of losing weight.
Wow, yeah.
Unfortunately, we did identify a number of risk factors in your pre-screen there. So this will classify you as a moderate risk client for the moment.
Yep.
All this means is we will require a clearance from your GP before we can begin the program.
Yep.
But once we do get this, we will just start you off on light to moderate activities.
Right.
So, just easy, like, weights and low weight, high repetition sort of stuff, and then a bit of walking, bit of bike.
Right. Do you do that with me?
I will, yeah, absolutely, yeah.
Okay.
Yeah, so...
a bit of support,
Yeah, no, for sure. So just like the light to moderate stuff, that's just to allow you to familiarise yourself with the program, get a feel for it and the exercises that we'll be doing.
Yeah.
And it establishes a base fitness level. So we can work from that and see how you progress as we go.
Okay.
How does that sound?
Sounds pretty good.
Sounds good to you?
Yeah, we've got to do something.
Yeah? So as with all cases, there is obviously a few risks with exercising. This includes sudden fluctuations in your blood pressure.
Yeah.
So, if you're lifting too much, your blood pressure will rise.
Yeah.
And that can be an issue. You may fall over, you may hurt yourself.
All right.
You may see sudden drops in blood sugar. Same as that's just, potential to harm you, and just general muscle and joint pains and potential for injury. But to reduce this risk, as I mentioned before, I will be supervising you at all times.
Good.
And obviously, mainly the program will be set up to be at your, level.
Yeah.
So it'll be a personalised program, and so we won't have you bench
Start
pressing.
hard.
Yeah, we won't have you bench pressing 100 kilos on day one, obviously.
Good one.
And obviously, the goal of this is to progress over time, and
Wonderful.
the more you progress, the harder it'll get, and it'll be good.
Yeah. Hopefully, I'll start to enjoy it.
I can guarantee you will. But just finally, I'd suggest maybe considering a consultation with an accredited dietitian.
Oh yeah, I've done the dietitian, but
Yeah.
maybe I should go back and get a few more tips.
Yeah, I just think they'd help you sort a diet plan.
Yeah, all right.
And they may be able to teach you a couple of healthy recipes that
Take
you
your
could.
wife along.
Yeah, absolutely, yeah. And so that could benefit yourself and the family. And I'd also suggest maybe meeting with a diabetes educator. What they do, they'll just help you with your issues that you're having with your insulin and your medication at the moment, and may help you set up a medication plan.
Yeah.
And just familiarise yourself in a routine sort of thing.
Yeah, that sounds like a good idea.
So yeah, along with those, obviously you'll be with me, and I think we should have you seen some great results, hopefully sooner rather than later.
Yeah, man.
But yeah, that's about it. So did you have any questions for me before we go?
No, I don't think so, Tom. I think you've covered everything pretty well.
Yeah, no worries.